Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Beta-Lactamase test. Explained methods and interpretation. Induced beta-lactamase detection. Table of contents. Introduction to beta-lactamase test. Objectives. Chromogenic cephalosporin test. Nitrocefin test of beta-lactamase test. Acidimetric method of beta-lactamase test. Iodometric method of beta-lactamase test. Introduction to beta-lactamase test. Beta-lactamase test is used to detect beta-lactamase enzymes produced by different bacteria. Beta-lactamase is a plasmid-encoded or chromosomal-encoded enzyme that hydrolyzes the beta-lactam ring of beta-lactam antibiotics, leading to drug inactivation. The beta-lactam gene frequently resides on integron. The first beta-lactamase was described in 1940 as a penicillinase, capable of hydrolyzing penicillin in E. coli. Beta-lactamase enzyme production may be constitutive or induced by exposure to antimicrobials. According to the Bush-Medeiros classification system, beta-lactamase enzymes are divided into 4 molecular classes, AD, based on their amino acid structure. Beta-lactamase enzymes are detected by rapid beta-lactamase tests, which provide results faster than MIC or disk diffusion tests. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Objectives. Detect the enzyme beta-lactamase using chromogenic, iodometric, and acidometric tests. Identify beta-lactamase-mediated resistance in various bacterial organisms. Chromogenic cephalosporin test, Nitrocefin test of beta-lactamase test. Principle of Nitrocefin test. Nitrocefin discs are impregnated with nitrocefin, a chromogenic cephalosporin. Bacteria producing a significant amount of beta-lactamase enzyme hydrolyze the amide bond in the beta-lactam ring. The hydrolysis causes a color change in the nitrocefin disc from yellow to red, indicating a positive test. If the color remains unchanged, the test is negative. These beta-lactamases can inactivate penicillinase label penicillins, such as amoxicillin, ampicillin, penicillin, carbonicillin, meslocillin, and piperacillin. Requirement of nitrocefin test. Nitrocefin disc, commercially available, follow manufacturer instructions, stored at 2 to 8 degrees Celsius. Sterile distilled water, glass slide or empty petri dish. Sterile Pasteur pipette. Sterile wooden stick and inoculating loop. Test organism colony grown overnight, 18 to 24 hours, on non-selective media. Procedure of nitrocefin test. Using sterile forceps, dispense the required number of nitrocefin discs onto a clean microscope slide or an empty petri dish. Allow the nitrocefin disc to reach room temperature before inoculation. Moisten each disc with 1 drop of sterile distilled water. Using a sterile loop or applicator stick, smear several colonies onto the disc surface. Additionally, smear the positive control strain colony and the negative control strain colony. Observe the disc for a color change. Positive results usually appear within 15 seconds to 5 minutes. If no color change occurs within 5 minutes, the test is negative. However, positive reactions for some Staphylococci may take up to 1 hour. Results and interpretation of the nitrocefin test. Positive result. Yellow color changes to red when the culture is inoculated. Negative result, no change in the color of the disc. Positive and negative controls. Positive control, Staphylococcus aureus, ATCCT29213. Quality control. Negative controls, Haemophilus influenzae, ATCC1021. Quality control, Staphylococcus aureus, ATCC22923. Applications of Nitrocefin test. The Chromogenic Cephalosporin test, Nitrocefin, is a sensitive method for detecting beta-lactamase-producing strains of Neisseria gonorrhoeae, Haemophilus influenzae, Staphylococcus species, Enterococcus species, and Moraxella catarrhalis. It is the most reliable test for detecting beta-lactamase-producing Enterococcus species, easy to perform, and provides results earlier than other methods. The chromogenic method is quicker and more convenient than the acidimetric and iodometric methods. High sensitivity and efficiency due to the detection of both penicillinase and cephalosporinase enzymes produced by bacterial isolates. The Nitrocefin test is the only reliable test for detecting beta-lactamase production by Enterococcus species. It has been used to detect beta-lactamase produced by Achromobacter species. Nitrocefin has wide susceptibility and sensitivity to commercially available beta-lactam antibiotics. Limitations of the Nitrocefin test. Moistening the disc is critical for color development. If the disc begins to dry out, it may need rehydration with a small amount of water. Indistinct and weak reactions may occur for strains grown on blood agar plates. Beta-lactamase detection with the Nitrocefin disc should not entirely replace conventional susceptibility test methods, as other factors influence test results, and intrinsic resistance to beta-lactam antimicrobials is not always correlated with beta-lactamase production. Avoid oversaturating the tip, as it could dilute the reagent. Detection of beta-lactamase activity in Staphylococci may take up to 1 hour, and enzyme induction may be required. This can be achieved by testing growth from the zone margin around an oxacillin disc. A negative result does not rule out resistance due to other mechanisms. The Nitrocefin disc method is not suitable for testing Enterobacteriaceae, Pseudomonas species, or other aerobic gram-negative bacilli, as results may not predict susceptibility to beta-lactams commonly used in therapy. The Nitrocefin disc cannot be used for organisms where penicillin resistance is not due to beta-lactamase production, such as Streptococcus pneumonia and other Streptococcus species. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Acidimetric method of beta-lactamase test. Principle of acidimetric method. In the acidimetric test, the penicillin phenol red substrate reacts with the beta-lactamase enzyme, leading to the production of penicilloic acid. The production of penicilloic acid lowers the pH, causing a color change in the disc or solution in the tube test. The color shifts from violet or red to yellow, indicating a positive test. If no color change occurs, the test result is negative. Requirement of acidimetric method. For disc or strip test, acidimetric disc, commercially available, follow manufacturer instructions, stored at 2 to 8 degrees Celsius, sterile distilled water, glass slide or empty Petri dish, sterile Pasteur pipettes, sterile wooden stick and inoculating loop. Test organism colony grown overnight, 18 to 24 hours, on non-selective media. For tube test, 0.5%, phenol red. Solution, dissolve 0.5 grams of phenol red in a small amount of water. Heat if necessary, then make up the volume to 100 milliliters. Store at 25 degrees Celsius. Shelf life, 6 months. Crystalline potassium penicillin, G. Use a vial containing 20 million units. Store as per manufacturer's instructions. 1. N. NaOH. Dissolve 4 grams of NaOH crystals in 100 milliliters of water. Caution, heat production occurs. Store at 25 degrees Celsius. Sterile 1 milliliter and 10 milliliter pipettes with a pipette bulb. Sterile polystyrene capped tubes, 12 by 75 millimeters. Sterile wooden applicator sticks or inoculating loops. Preparation of penicillin phenol, red substrate reagent. Add 2 milliliters of 5% phenol red solution to 16.6 milliliters of sterile distilled water. Mix the 18.6 milliliter phenol red water solution with a vial of crystalline benzyl penicillin, G. Transfer the solution from the vial into a sterile container. Add 1 normal NaOH dropwise to the acidic solution until a violet color pH 8.5 develops. Dispense 0.1 milliliter aliquots into sterile tubes and store at -20 degrees Celsius or lower in a non-frost-free freezer. Procedure for acidimetric disc test. Using sterile forceps, place the required number of discs onto a clean microscope slide or an empty Petri dish. Immediately return the unused discs to the freezer. Allow the acidimetric disc to reach room temperature before inoculation. Moisten each disc with 1 drop of sterile distilled water. Using a sterile loop or applicator stick, smear several colonies onto the disc surface. Also, smear colonies of the positive control strain and negative control strain. Observe the color change on the disc. Positive result. Color change appears within 10 minutes. Negative result, no color change within 10 minutes. For some staphylococcal strains, a positive reaction may take up to 1 hour. Once dry, the color remains stable for up to 24 hours. Procedure for tube method of acidimetric test. Remove the required number of reagent tubes from the freezer and allow them to thaw at room temperature, 1 tube per test organism. Using a sterile loop or applicator stick, add 4 to 5 colonies to the test solution to form an opaque, milky suspension. Observe for color change. Positive result. Color change occurs within 15 minutes. Negative result, no color change within 15 minutes. Delayed color change, after 15 minutes, indicates substrate deterioration, not beta-lactamase activity, and should not be considered positive. For some staphylococcal strains, a positive reaction may take up to 1 hour, but results beyond 15 minutes may not be reliable. Results and interpretation of acidimetric method. Positive result. Violet or red color changes to yellow, indicating the presence of beta-lactamase activity. Negative result. No change in color, indicating the absence of beta-lactamase enzyme. Applications of acidimetric method. More effective than the Iodometric method for detecting coagulase-positive staphylococcal beta-lactamase. Rapid acidimetric method is used for beta-lactamase detection in Haemophilus species, Neisseria gonorrhoeae, and Staphylococcus species. Easy to perform and interpret, making it a convenient diagnostic tool. Limitations of acidimetric method. Applicable only to aerobic bacteria, limiting its use for anaerobic organisms. Cannot differentiate between acylase and beta-lactamase activity, which may lead to misinterpretation. Detects only penicillinase, not cephalosporinase, making it unsuitable for detecting resistance to cephalosporins. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Iodometric method of beta-lactamase test. Principle of the iodometric method. This method relies on the ability of beta-lactamase to hydrolyze penicillin G, producing penicilloic acid, which acts as a reducing agent. The reduction of iodine prevents it from forming a dark blue iodine starch complex, leading to discoloration, which indicates a positive result. Requirements for the iodometric method. Penicillin solution, 6,000 micrograms per milliliter, dissolved in phosphate buffer, pH 6.0, 0.05 to 1 molar. Store at 2 to 8 degrees Celsius. Shelf life, 24 hours. Starch reagent. Dissolve 1 gram of soluble starch in 100 milliliters of distilled water and heat in a boiling water bath until fully dissolved. Store at 2 to 8 degrees Celsius. Shelf life, 1 week. Iodine reagent. Dissolve 2.03 grams of iodine and 53.2 grams of potassium iodide in a small volume of distilled water. Then, adjust the final volume to 100 milliliters. Store at 2 to 8 degrees Celsius in a dark bottle. Replace if a precipitate appears. Shelf life, 2 months. Sterile microdilution tray or small test tubes. Sterile 1 milliliter pipettes and pipette bulb. Sterile wooden applicator sticks or inoculating loops. Procedure for the iodometric method. Dispense 0.1 milliliters of the penicillin solution into a well of a microdilution tray or a small test tube. Inoculate the test organism into the solution, forming an opaque, milky suspension. Add 2 drops of starch solution, mix well, and allow it to sit at room temperature, approximately 25 degrees Celsius, for 30 to 60 minutes. Add 1 drop of the iodine reagent, then shake or stir the mixture for 1 minute. Observe for color change. Decolorization, fading to white. Within 10 minutes gives positive result. No color change within 10 minutes gives negative result. Some staphylococcal strains may take up to 1 hour to show a positive reaction. Results and interpretation of the iodometric method. Positive result. Blue color fades to colorless. Negative result. Blue or purple color remains unchanged. Applications of the iodometric method. The iodometric slide test provides results similar to the Nitrocefin disc test, making it a useful alternative when chromogenic methods are unavailable for detecting staphylococcal beta-lactamase. More sensitive and accurate than the acidometric method for detecting beta-lactamase production by Staphylococcus species. The most reliable method for detecting beta-lactamase production in Neisseria gonorrhoeae. Limitations of the iodometric method. The iodometric test is specific for beta-lactamase detection, but does not detect cephalosporinase activity, unlike chromogenic methods. The requirement for freshly prepared starch and iodine solutions may limit its routine use in clinical settings. Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you!